we're taking a clear, evidence-based look at high-dose IV vitamin C and cancer. It is one of the most talked about integrative oncology therapies, and also one of the most misunderstood. Some people claim it's a miracle cure. Others say it does nothing. The truth is far more nuanced. Hi, everyone. I'm Keith Bishop, clinical nutritionist, cancer coach, and founder of Prevail over Cancer and the Prevail Protocol. In this video, you'll learn how IV vitamin C works against cancer, why IV dosing is completely different from oral vitamin C, what the research shows about anticancer effects, typical clinical doses, required safety labs, and how it fits in with chemo, radiation, and immunotherapy. Does this sound like the information you want to learn about? Let's get started. Oral versus IV vitamin C. First, the biggest misconception. You cannot take enough oral vitamin C, even liposomal, to reach anticancer treatment levels. Yes, liposomal supplements are better absorbed, reduce gut irritation, and provide higher blood levels than traditional vitamin C supplements. Your gut simply can't absorb it fast enough. Blood levels plateau at too low a level, but IV vitamin C bypasses the gut entirely. It reaches blood concentrations 100 to 500 times higher than oral dosing. These extremely high levels, called pharmacologic levels, are what create the anti-cancer effects. This is why IV vitamin C is considered a pharmacologic therapy, not a nutritional supplement. How IV vitamin C works against cancer. Modern research identifies 5 major mechanisms. 1. Pro-oxidant hydrogen peroxide. At high concentrations, vitamin C flips from antioxidant repair to pro-oxidant damage. It generates hydrogen peroxide around and in cancer cells. Healthy vitamins can neutralize it. Cancer cells often cannot. This selective stress can damage or kill cancer cells. 2. Disruption of tumor metabolism. Many tumors rely heavily on glycolysis, the use of your body's glucose, the Warburg effect. Tumor cells take in the vitamin C thinking it's sugar and can't use it. IV vitamin C can interfere with this energy pathway, stressing cancer cells metabolically. 3. Epigenetic modulation. High-dose vitamin C activates TET enzymes. These enzymes help restore normal DNA methylation patterns. That means tumor suppressor genes may be reactivated. 4. Reduction of HIF-1 alpha. HIF-1 alpha helps tumors survive in low oxygen environments. IV vitamin C may reduce HIF-1 alpha, making tumors less aggressive. 5. Immune support. IV vitamin C supports immune cell function. It may help patients tolerate treatment better and maintain strength. Typical clinical doses. In oncology settings, doses vary based on goals. Supportive care, think of prevention, 25 to 50 grams once a week. Adjunctive anti-cancer protocols, in addition to medical and integrative therapies, 50 to 75 grams, 2 to 3 times a week. High-dose pro-oxidant damaging therapy, 75 to 100 grams or more, 2 to 3 times a week. These ranges reflect doses used in human clinical trials. How clinicians determine the right dose. There is no single test that determines the optimal dose. Instead, clinicians use safety labs, patient factors, and dose escalation. Required safety labs. Before starting IV vitamin C, every patient needs a G6PD test. This is mandatory. Kidney function labs, creatinine and eGFR, a basic metabolic panel, electrolytes and hydration status. These labs determine whether a patient can safely receive 25, 50, 75, or 100 grams. What about urine vitamin C strips? They do not correlate with therapeutic blood levels. They are not used to determine IV vitamin C dosing. What about blood glucose? High-dose vitamin C can cause falsely high readings on fingerstick glucometers. Since vitamin C can raise fingerstick glucose readings, some clinics use fingerstick glucose readings to determine everyone's vitamin C dose. Plasma vitamin C levels. Some clinics measure plasma vitamin C ascorbate levels after infusion. This is optional, but it can confirm that the patient is receiving the pharmacologic dose. The goal is 20 to 30 millimoles. Dose escalation. Most clinicians start low and increase gradually. They monitor tolerance, hydration, electrolyte levels, and interactions with treatments. The individualized approach is why there is no universal correct dose. Oral liposomal vitamin C between infusions. Oral vitamin C cannot reach pharmacologic levels, but it can support baseline antioxidant status between infusions. It may support immune function and reduce oxidative stress, but it does not replicate the anticancer mechanisms of IV vitamin C. A high dose of vitamin C IV 2 to 3 times a week is often better than one IV vitamin C infusion with oral liposomal vitamin C 6 days a week. How IV vitamin C interacts with treatment. Chemotherapy. Early research suggests IV vitamin C may enhance chemotherapy-induced DNA damage, reduce toxicity for many patients, and improve quality of life. Large trials are still needed, but the early data is promising. Radiation therapy. IV vitamin C may increase oxidative stress inside tumors while protecting healthy tissues from collateral damage. Immunotherapy. IV vitamin C supports immune function, and early research suggests it may complement immunotherapy, but this area is still emerging. Conclusion. High-dose IV vitamin C is not a standalone cure, but it is well-tolerated, evidence-supported adjunctive therapy. When used correctly with proper labs, dosing, and clinical oversight, it may provide quality of life, reduce treatment-related toxicity, and potentially enhance the effectiveness of conventional therapies. If you want more evidence-based cancer education, check out the resources linked below. Thank you for subscribing, liking, and sharing our content. Together, we prevail over cancer.